period after childbirth is a special time, filled with a mix of emotions and experiences that are both challenging and rewarding. It's a time of immense change, both physically and emotionally. New mothers often find themselves navigating a whirlwind of feelings, from joy and excitement to fatigue and uncertainty. This period is called the Puerperium, often referred to as the fourth trimester. It's a crucial phase that bridges the gap between pregnancy and the return to a non-pregnant state. It lasts for about 6 to 8 weeks after delivery, though the exact duration can vary from one woman to another. During this time, a woman's body goes through incredible transformations as it returns to a non-pregnant state. These changes are not just physical, but also hormonal and emotional. This transition involves hormonal shifts, organ readjustment, and emotional adaptation. The body works tirelessly to restore balance and support the demands of motherhood. Understanding the puerperium is crucial for both women and their healthcare providers. Knowledge about this period can help in managing expectations and addressing any concerns that may arise. This period is not just about physical healing, it's also about emotional adjustment. New mothers often need time to process their birth experience and adapt to their new role. New mothers are learning to breastfeed, bond with their baby, and navigate their new role. Each day brings new challenges and milestones. Sleep deprivation is common, and hormonal fluctuations can lead to mood swings. It's important to recognize these changes as a normal part of the postpartum journey. It's a time of intense learning and adjustment, and support from healthcare providers, family, and friends is essential. This support can make a significant difference in the mother's recovery and well-being. The puerperium is a critical period in a woman's life. It deserves attention and care, not just from healthcare professionals, but from everyone around the new mother. It deserves attention and care. Regular checkups and open communication with healthcare providers can help address any issues promptly. The puerperium is a time of profound change, but it's also a time of incredible joy. The bond between mother and baby grows stronger each day. Women are getting to know their babies, and their bodies are healing and recovering. This period is a testament to the resilience and strength of new mothers. This transition is a natural and beautiful part of the childbirth journey. It's a time to reflect on the incredible journey of bringing new life into the world. It's important to approach it with patience, self-compassion, and a strong support system. Self-care and seeking help when needed are vital for a healthy recovery. By understanding the changes happening in the body and mind during the puerperium, women can feel empowered to take care of themselves and their babies. This knowledge fosters confidence and a sense of control during this transformative time. As soon as the placenta is delivered, the amazing process of involution begins. This is a crucial phase in postpartum recovery where the body starts to revert to its pre-pregnancy state. The uterus, which expanded to accommodate the growing baby, now begins to contract and shrink. This refers to the shrinking of the uterus back to its pre-pregnancy size. The process is gradual and can take several weeks to complete. During this time, the uterus undergoes significant changes, reducing from the size of a watermelon to that of a pear. It's driven by hormones and can be uncomfortable, causing afterpains that feel like menstrual cramps. These afterpains are a sign that the uterus is contracting and shrinking, which is a positive indication of healing. These cramps are usually mild but can be more intense after subsequent pregnancies. The intensity of the cramps can vary from woman to woman, and they often become more noticeable during breastfeeding due to the release of oxytocin. Beyond the uterus, other organs are also finding their way back to their normal positions. The abdominal organs, which were displaced during pregnancy, gradually return to their original locations, contributing to the overall recovery process. The cervix, which was stretched thin for childbirth, gradually closes and regains its shape. This process can take several weeks, and it's essential for preventing infections and ensuring the body's return to its pre-pregnancy state. The vagina, stretched during delivery, slowly returns to its pre-pregnancy size, though it may not be exactly the same. The vaginal tissues heal and regain their elasticity, although some changes in shape and tone are normal. Hormonal changes also influence bladder control, and it's common to experience some leakage, especially after vaginal delivery. Pelvic floor exercises can help strengthen the muscles and improve bladder control over time. The body's incredible ability to heal itself is evident in the postpartum period. This self-healing process is supported by rest, proper nutrition, and gentle physical activity. The site where the placenta was attached inside the uterus heals, and any tears or cuts from delivery gradually mend. This healing is crucial for preventing infections and ensuring the overall health of the mother. Lochia, the vaginal discharge after delivery, is a visible sign of this healing process. It consists of blood, mucus, and uterine tissue, and its progression indicates the body's ongoing recovery. It starts off bright red, then gradually lightens in color and flow over several weeks. This change in lochia is a normal part of the healing process, signaling that the body is returning to its pre-pregnancy state. The puerperium is not just about physical healing, it's also a time of significant emotional adjustments. This period, often referred to as the postpartum period, involves a complex interplay of hormones that can significantly affect a new mother's mood and overall emotional well-being. The dramatic drop in estrogen and progesterone levels after delivery can trigger mood swings, often referred to as the baby blues. These hormonal changes are a natural part of the postpartum process, but they can feel overwhelming and unexpected for many new mothers. These mood swings are very common, affecting up to 80% of new mothers. It's a shared experience that many women go through, and understanding this can help in feeling less isolated during this challenging time. Symptoms can include tearfulness, irritability, anxiety, and feeling overwhelmed. These emotional responses can vary in intensity and duration, but they are a normal reaction to the significant changes happening in a new mother's body and life. It's important to remember that experiencing the baby blues is normal. It doesn't mean you're doing anything wrong. Support from loved ones and healthcare providers can make a big difference in navigating these feelings. These feelings are usually temporary and tend to subside within a week or two without needing medical treatment. However, during this time, self-care and emotional support are crucial in helping new mothers cope. However, if these feelings persist or worsen, it's crucial to reach out to your healthcare provider. Persistent mood swings or feelings of sadness may indicate a more serious condition that needs attention. It's possible you may be experiencing postpartum depression, a more serious condition that requires professional help. Postpartum depression is more intense and longer lasting than the baby blues, and can significantly impact a mother's ability to care for herself and her baby. Hormonal changes can also impact energy levels and sleep patterns. The demands of caring for a newborn can lead to significant sleep deprivation, which further affects a mother's mood and energy. Caring for a newborn around the clock is demanding, and sleep deprivation is a common experience for new parents. This lack of sleep can make it even harder to manage the emotional ups and downs of the postpartum period. This lack of sleep can exacerbate mood swings and make it challenging to cope with the demands of motherhood. It's essential to recognize the impact of sleep deprivation and seek ways to mitigate it. It's important for new mothers to prioritize rest whenever possible and accept help from partners, family, or friends. Building a support network can provide much-needed relief and help new mothers navigate this challenging yet rewarding time. Puerperal care encompasses the holistic support provided to women during the postpartum period. It focuses on both physical recovery and emotional well-being. Key goals include preventing and managing complications, promoting breastfeeding, ensuring adequate pain relief, and supporting the mother's emotional and mental health. One of the primary aims of puerperal care is to monitor for and manage potential complications. This includes assessing vital signs, monitoring bleeding, checking for signs of infection, and addressing any pain or discomfort. Regular checkups with healthcare providers are crucial during this period to ensure any issues are identified and addressed promptly. Promoting breastfeeding is another important aspect of puerperal care. breastfeeding offers numerous health benefits for both mother and baby. Lactation consultants can provide valuable support and guidance to new mothers, helping them establish a successful breastfeeding relationship with their babies. Addressing pain effectively is essential for maternal comfort and recovery. Pain can arise from the birth itself, after pain, or breastfeeding. Healthcare providers can recommend appropriate pain relief options, including over-the-counter medications or prescription painkillers if needed.